Hygiene. Wow.
As the
Hello.
Good evening, everyone, and a very warm welcome. My name is Mira West, and on behalf of the Foresight Institute of Research and Translation, FIRAT, I am delighted to welcome you to this special broadcast of the Dental Medicine Chronicles launch. We are streaming live on our Brave Talk live session and YouTube channel for a discussion on a topic that is absolutely foundational to our general well-being, the importance of oral hygiene. We are privileged to have an incredible group of experts with us tonight to share their insights. Guiding our conversation is the coordinator of the Dental Medicine Chronicles, Mr. Eric Ishimwe. Mr. Eric is a passionate and resilient doctor of dental surgery student at the University of Rwanda and a dedicated public health advocate. Driven by the conviction that oral health is essential to general health, his volunteer work with the Operation Smile student program, where he helps coordinate community outreach, truly exemplifies the next generation of healthcare leadership in Africa. Joining Mr. Eric is a distinguished panel of dental surgeons and academics from across the continent. First, it is a profound honor to introduce Associate Professor Taufik Olaleka Ligali. Professor Ligali is an eminent figure in African dentistry, serving as the Dean of the Faculty of Dentistry at the University of Maiduguri. With a specialized fellowship in child dental health and an MSc in epidemiology and dental public health from University College London, his work focuses on creating evidence-based solutions for vulnerable populations. We are also thrilled to be joined by Dr. Omotoyosi Oyewole. Dr. Oyewole is a dynamic dental surgeon practicing at Randall General Hospital for the Lagos State Health Service Commission. A graduate of the University of Lagos, she is recognized for her expertise in comprehensive patient care and her deep passion for community engagement, including developing patient education materials and extensive volunteer work in health outreach. And rounding out our expert panel is Dr. Abraham Munyemiza. Dr. Munyemiza is a dedicated dental surgeon at the University Teaching Hospital of Butare, CHUB, in Rwanda. We are so grateful for his time and look forward to hearing his clinical perspectives on this topic. We have a wealth of knowledge and experience assembled for you tonight. I want to thank you all for tuning in to this vital conversation. And now, to begin the discussion, please let me hand over the floor to your host, Mr. Eric Ishimue. Mr. Eric, over to you.
Muniruddin.
Hello, can you hear me?
Hear you
So,
now. Just increase your volume. We can hear you now. Thank you.
thank you very much. So, good evening, everyone. My name's, as Ella has said, my name's Al Edi Kishime, and I am the coordinator of Dental Medicine Chronicles. And sorry for the inconveniences. My camera, I think my was not working well. Was not working well. So, I think now we can begin. I think now we can begin with our conference as the launch of the Dental Medicine Chronicles. So this is a project in a collaboration with Rwanda Dental Medical Society, with the Filat Rwanda, with Filat Africa. So the project mainly emphasizes, will be emphasizing on the Africa at the heart, oral health. So it was prepared by the scientific and the technical advisory committee with chair Professor Ahmed Adedeji. Thanks to him for his inspiration and for helping us. So I am going to start by I am going to start by talking about this project, how it will be. Then after that, I will give the floor to the to our guest speakers, and there will be a time for questions. And also, there will be a time for the audience to ask questions about the Dental Medicine Chronicles project as it will be demonstrated here. So, again, thank you for your patience. So, a little background on about the Dental Medicine Chronicles. So, we all know oral health is an integral part of the overall health and well-being. Yet, it is often overlooked in health systems, community priorities. So, poor oral hygiene is linked to systematic diseases, as we will see today. And that's one of the reasons we started this project, such as diabetes, cardiovascular diseases, and adverse effects. In many African, yes, So I'm asking if you can hear me. So
Hear you now.
yeah, thank you very much. I think this is a new platform for me to use. But now everyone can hear me.
Yes. Yes.
So welcome back to the dental medicine community, and thank you all for your patience. The platform has not been where bad now it is. So welcome to the Dental Medicine Chronicles launch. So you can ask yourself why Dental Medicine Chronicles and why are we starting now? So a little background on it. As point of addition, this is a project prepared by Filat Rwanda with Dental Medical Society Rwanda, collaborating with Africa Wide Vision, and it was prepared by the Scientific and Technical Advisory Committee, which is chaired by Prof. Ahmed Adedeji. Thanks for his insight. So, a little background is that oral health is an integral part of overall health and well-being. It is often overlooked in health systems and community priorities. Health is linked to systematic diseases, diabetes, cardiovascular illness, and others. In many African countries, access to affordable dental care remains limited. Preventative practices are underdeveloped. Building on successful models of the nursing diary, we have come across with an idea to start the Dental Medicine Chronicles. So you can ask yourself, what are the purposes and the initiatives of this project? Mainly, this project will focus on to create a content-wide platform for dental professionals to share experiences, innovation, and challenge they face in their daily work, and also to highlight the connection between oral health and broader health outcomes, advancing the African health agenda. Also, another important purpose of this initiative is to systematically engage practitioners, communities, and policymakers, transforming grassroots oral health challenges, which will be turned into research and project. Don't get that. Iri kwisubiramo. So thank you again, but let me give the floor to Dr. Prof Legali. The floor is yours. So I was saying, let me give the floor to Dr. Legali.
Hear me? Hello?
Hey,
Hello, please, can I be heard?
yes.
Okay, thank you. So I understand I can come in now. I say good evening to everyone. I'm happy to be here. It's a great privilege that I've been selected to speak uh, today. So, well, thank you very much. So I await questions from the audience. Does this an interview? It's an interview forum.
So, Prof, good evening again.
Good evening.
So my first question is, we wanted to start with the connection between the we because you are a professor, we want to start with education. So digital innovation is transforming dental education globally. Frontiers in dental education know that over 70% of dental schools worldwide now use AI-driven diagnostic, digital imaging, and 3D printings. So my question is, long-term view toward 255.
Hello? If I hear you well, you're asking about the application of digital dentistry or digital dentistry in the current and emerging oral health challenges we have. Am I correct?
So my question is, with a long-term view toward 2035, how must African dental education and broader research culture adapt in terms of technology, specifically mentioning the digital dentistry and AI application, to effectively meet the continent's current and emerging oral health challenges?
Okay, thank you very much. I got that. First of all, let us appreciate the continent's current oral health challenges. Globally, oral diseases, while largely preventable, they pose a major health burden for many countries and affect people throughout their lifetime, causing pain, discomfort, disfigurement, and even death. It is estimated that oral diseases affect nearly 3.7 billion people worldwide out of 8 billion that we have as at 2024 globally. Untreated dental caries, that is tooth decay of the permanent teeth, is the most common health condition according to Global Burden of Disease in 2021. Prevention and treatment for oral health conditions is expensive and usually not part of the national universal health coverage, which is supposed to be of benefit to everyone. Now, most low and middle income countries in which Africa belongs, many major African countries belong, okay, do not have populations is another key fact. People of low socioeconomic status bear a higher burden of oral diseases, which can affect them throughout their lives due to lack of means of care. There's limited access to care generally, limited workforce as well. There's an inverse provision of care generally. Underlying risk factors are shared, we have shared risk factors from oral disease and other chronic diseases, which include poor oral hygiene, tobacco, alcohol use, and high sugar consumption. Treatment-oriented systems too should be looked into. Many oral health systems in Africa are primarily focused on curative care with limited investment in prevention. One very fundamental way of tackling our oral health challenges is by using what we call common risk factor approach. This is an integrated health promotion strategy whereby underlying determinants of health, which are risk factors that are common to both oral health and overall health, tackled or addressed. For example, if you took a is not only linked with gum diseases, but also diabetes and cardiovascular disease. This means that if poor oral hygiene is addressed, there will be control of gum disease, diabetes, and cardiovascular disease, among other chronic illnesses. This strategy is most cost effective and efficient. Now, going back to the question, digital dentistry uses computer controlled technologies to improve oral hygiene and dental care, offering enhanced accuracy, efficiency, and the rest. Efficiency in diagnosis, in treatment planning, and restorative care. Because of the burden of oral diseases in Africa, as highlighted earlier, as we started earlier, we require early diagnosis, prevention of these diseases, and efficient treatment. So the key digital dentistry technologies that we can have that will have impact on oral health will include digital imaging. Digital imaging makes use of digital radiographs to improve our diagnostic acumen, the accuracy of diagnosis. So we have digital radiographs to improve the diagnosis. Intraoral scanners are also available to make accurate digital impressions and therefore precise study models. We have computer-aided design and computer-aided manufacturing, CAD/CAM we call it. This allows for the design and manufacturing of dental restorations like crowns and veneers, which can often be completed in a single visit, so allowing better convenience for the patients. We have three-dimensional printing instead of the two-dimensional printing we usually have. So it's in three dimensions. We have dimension in height, the width, and depth. This technology includes surgical guides. They can be included for surgical guide, indentures, and models, which increase efficiency and can lead to more personalized treatments. Artificial intelligence, AI, is now common around us, so we must make use of it in dentistry. AI helps to analyze diagnostic data, plan treatments more precisely, and can assist in monitoring patient care. Then, of course, we have teledentistry and mobile health, mHealth. These tools facilitate remote consultations, patient monitoring, and the dissemination of oral health information. They can improve access to care, especially for remote or mobile populations. But what are the challenges we may have with this? The challenge of cost with digital dentistry. There will be a big challenge of cost. The initial investment in digital technology can be high, but this is where funding can come from government, from non-governmental organizations, from donors, from partnerships. Then training is another important consideration. Dental professionals require training to use the new technologies effectively. This can also come in form of exchange programs, intra-regional or inter-regional programs to train ourselves on the use of digital dentistry. Data security is also of concern, the security of the data that is transmitted digitally. As with any digital system, there are concerns about data privacy and security. There must be regulations governing digital exchange of patients' records. I hope with this I have delivered something, some message concerning digital dentistry. Thank you. Are we together?
Yes, we are together.
Thank you. Any more questions?
Hello there,
Well,
Professor.
Prof, hello, Prof.
Hello.
Hello, I'm with you.
Yeah,
Yes.
sorry,
Sorry.
am I protected to talk? Can I go ahead, sir?
Yes, please. Please go ahead.
Thank you very much for the an insightful and brief concerning digital dentistry. Yes, I want to pick from the initial one we discussed concerning improving oral health care, as it's almost 50% overwhelming disease burden. About out of 8 billion, we're having 3.5 billion beings with oral health burdens. I want to diverse a bit concerning the integration. I thought the oral health integration, national oral health integration, the oral health policy of 2024 address some part of this, that primary oral health, especially, most especially because of the prevention.
Hello there.
I'm here. Okay. I'm with you, please.
Oh,
I think it's one of
what
those.
specific
Okay.
measurable success would we observe in the African oral health landscape in terms of policy integration, public behavior, and disease burden as a tangible vision for success, making the project's goals concrete? What do you expect if you Dental Medicine Chronicles carries its mission? Uh, which picture can you see in as a change in Africa oral health? Thank you.
Okay, if I get the message properly, it's about what are the measurable successes that that can be observed in African oral health landscape looking forward up to 2035. What do we envisage? Okay, well, unfortunately, most of the oral health services is not covered by the 2030 Sustainable Development Goals of United Nations. Why? Because oral health care is expensive. This is why we have to think out of the box to solve our own regional oral health problems. We have common oral health problems which arise from poor oral health awareness, poor economic and health policies. There will be measurable success if there is advocacy for increased public oral health awareness, advocacy for making healthier choices the easier choices. That is, make healthy foods, clean drinking water, fruits and vegetables, oral hygiene aids, make them easier choices. for people and make the unhealthy difficult, such as tobacco, alcohol, and all that we know. This can be done through regulations and fiscal policies. Experts and professionals across the continent can meet on ways to discuss with policymakers concerning this. Another point is success will occur with purposeful intercontinental research collaboration, which is based on development of local technologies to create a bright future for improvement in our self-reliance, to create more job opportunities and reduction in brain drain, what we usually call here in Nigeria Japa syndrome. Many countries are suffering from brain drain. Success will occur where there is advocacy for improved funding for primary health care. It is seen that around 70% of sub-Saharan African countries spent less than $1 per person per year on treatment cost for oral health care as at 2019. Success will occur with improved welfare packages as incentives for all health personnel who are on ground and decided to stay. African regions' oral health workforce is chronically lacking, with a ratio of just 3.3 dentists per 100,000 people recorded between 2014 and 2019, and yet many are moving out day by day for greener pastures. Success will occur when there is provision of community oral health insurance. This will enable universal coverage of health within regions and reduce health inequality. Success will also occur when it will be achieved when oral health promotion is accessible to the vulnerable population, including children, older people, women, individuals with special needs. This will improve their access to healthcare and reduce health inequality. Thank you.
So thank you very much, Prof. So I think I've asked you now some of the questions. So I would also like to give the floor to Dr. Miliam Omotoyosi. So for him also to get the floor and we can ask her questions. Doctor, can you hear me?
Yes, I can hear you. Good evening, everyone,
Good
and
evening.
thank you for the privilege to come to your.
So thank you very much. Also, if it will not be a problem, we would also like you to share with us your screen so the audience can get also the picture of the person they are talking to.
Okay, so we can continue. We can proceed with the interview. I will share my
Yeah,
screen over time. I wasn't prepared to do that, so I will
yeah,
do
no
that over.
problem.
Mm.
Yeah, sorry for that. So my question for you is about the holo systemic connection between diseases and the diseases, holo health and the full whole body diseases. So my question is, holo health is often viewed in isolation. Could you articulate the critical scientifically backed the connection between optimal holo health and overall systemic well-being, explaining why it must be viewed as a foundational pillar of general health and not merely a cosmetic practice? So can you elaborate on that?
Okay, so thank you very much. I'm not sure. Can you see me? Can you see me clearly?
Yeah, we can see you clearly. Thank you.
Okay, so thank you for the privilege to come here. If I got your question correctly, you're asking about the relationship between oral health and the entire body system, the general well-being of the human being. And then Firstly, I would like to mention that people view oral health in isolation. They have this they have this imagination that it's just my mouth, it's not related to my whole body, it's isolated, they treat it in an isolated manner. However, the oral environment is the entrance into the body, is the major opening into our body, and we are supposed to prioritize taking care of it more than anything else. The oral environment, if we study our body generally, fine, we have the nasal opening, but it's not as large, it's not as accommodative as our oral environment. And when we are talking about oral health, we're not just talking about the teeth, we're talking about the oral system. The oral system entirely comprises of the teeth, comprises of the periodontium, that is your gum, the pink part that you see when you smile into the mirror. It comprises of your tongue too. The tongue is a muscular structure, but is a part of the oral environment. And then it comprises of you have the soft palate, you have the hard palate. Don't let me bore you with all those details, but generally, I just want to educate you that the oral health is not just about my teeth are white. So when we say teeth is plural, tooth is singular. So when you say my teeth are white, I'm fine, that does not capture it all. So linking the oral health and the overall system well-being is more profound than you might think, because research has shown that there's a significant correlation between gum diseases, let's bracket it as periodontitis, and various systemic conditions. For example, we have um, gum disease relationship with systemic inflammation. When bacteria accumulate on the teeth, as I told you, the teeth is everything while a tooth is singular. So when bacteria accumulate on the teeth, it causes inflammation in the gums, which can lead to periodontitis. That's inflammation of the gum. Inflammation doesn't just stay in the mouth, it can spread systemically, contributing to chronic inflammation in the body. So that is why there are several studies that we've done, dentists have done, dental researchers have also done in this field, linking the oral health to the systemic health. And we have I highlighted some diseases that you would know that they are significant for them. And as practitioners or as health advocates, it's our job to make sure that people that are prone to these diseases are sent for their regular health checkups, dental checkups. We have this bi-directional relationship that we're supposed to co-manage patients and not single-handedly manage patients. For example, we have cardiovascular diseases. The bacteria from the gum can enter the bloodstream, increasing the risk of cardiovascular diseases, heart attacks, and strokes. So even known diagnosed cardiovascular patients are supposed to have, in between their routine medical checkups, a compulsory dental checkup or compulsory dental checkups, to have this bi-directional, like we have to co-manage. You don't have to single-handedly manage the patient. Another one we have is diabetes. Gum disease has been shown to make it harder to control blood sugar levels, and people with diabetes are more susceptible to gum diseases. As I mentioned earlier, there's a bi-directional relationship between diabetes and periodontitis. So I fortunately, one of the projects I did in my undergraduate days was on diabetes and periodontitis. And we've seen this two-way relationship between the two of them. You have patients coming to the clinic, I had a particular case of a woman with aggressive periodontitis. She was a young woman, unmarried, and then I kept wondering what was going on. Upon all investigations, we found out that she was diabetic, and we're the ones we're the ones discovering that for her. So there's this relationship between periodontitis and diabetes that is is not you cannot ignore it. It's not ignorable. So you have to manage your, and it's just the way I said, it's bi-directional. Diabetic patients too must take care of their oral hygiene optimally, because if they are not taking care of their mouth, if they are just worried about their blood sugar going down, then the oral condition can inhibit even the medications they are using to control the blood glucose from working appropriately. And so it's the same way. If their blood sugar is not well controlled, you have them presenting with oral symptoms and all. We have respiratory infections like bacteria from the mouth. We have respiratory infections like pneumonia. So bacteria from the mouth can be aspirated into the lungs and leading to pneumonia. Then there's also research going on about Alzheimer's disease. There's this research that suggests that there's a possible link between gum disease and increased risks of Alzheimer's. But we have to do more studies on that before we establish that. Then there are pregnancy complications too. The gum diseases have been linked to preterm babies. So because I'm pregnant, I'm not taking care of my oral hygiene, or I'm not fit psychologically and emotionally. It doesn't mean you should ignore your oral health, because at the end of the day, it can lead to complications like giving birth to underweight babies, low birth weight babies, and all. I hope I've been able to answer your question a bit. Thank you.
Thank you so much, Doctor, for your insight about the connection between oral health and the systemic function of the body. As you said, the diseases of the mouth or the oral diseases can be linked with cardiovascular diseases, research on Alzheimer's. So another question, but because the time is not on our side, it is not our friend. I wanted to ask another question, but I wanted it to be brief. So it's about your daily work. So, drawing from your daily clinical practice, what are the most relevant and often preventable oral health conditions you consistently encounter? In your estimations, what percentages of these cases would have been avoided with better public understanding and adoption of oral hygiene practices? Yes. So this question was directed to Dr. Miliam. Can you hear me?
I can hear you.
Dr.
Can you
Mil-
hear my response?
yeah, we can hear you. So another question I wanted you to be brief because the time is not our friend. So I was asking about when you draw a picture from your daily clinical practice, what are the most relevant and often preventable oral health conditions you consistently encounter? So in your estimations, what percentage of these cases could have been avoided with better public understanding and adoption of oral health practices?
Okay, so thank you very much for the question. Okay, since we want to be brief, let me just go straight to the point. Listing them, we have dental caries. So dental caries is something is tooth decay. The dental name or the medical name is dental caries, and then that's when you have untreated. Uh, from studies, untreated dental caries is the most common health condition globally. We have about 28.5% of population aged from 5 years and above. In Nigeria alone, over 90% of Nigerians suffer from dental caries, and this is something that could have been preventable. About 70 to 90% of dental caries could have been prevented by proper oral hygiene, dietary habits, and regular dental care. Just by brushing twice daily with fluoridated toothpaste and medium bristle toothbrush, you have cases that when you see them, you are sorry for the situation that you find yourself in, because this is something as simple. This is something that regular simple habits would have prevented. But let's move on. We have periodontal disease. So periodontal disease, as I explained earlier to you, is when you have inflammation of the gum. That's the green part. The green part. So the periodontium is not just the gum, but that's the only way I can really break it down for people to understand. The gum is covering the bone. There's a bone. It's a complex structure, but we call everything periodontium. So, and when you have inflammation or you have infection of that, we call it periodontitis, and that's something that could have been avoided still by practicing normal oral hygiene practices, regular dental checkups. So ideally, is this routine that if you come in regularly, at least 6 months for a dental checkup, you'll be examined thoroughly by the dental professional, and then anything coming up, it will be prevented, or if there's something that has started, we call some things incipient. If it's just starting, it will be corrected, and then solutions will be gotten. We have tooth loss. tooth loss is 50 to 70% preventable. That's the most painful one. Tooth loss is actually very preventable with the things that I still mentioned earlier. So you realize that the diseases I'm mentioning, they are the same prevention applies to most, not all. Well, most, because if you have your regular dental checkups, you won't be having severe periodontitis that is allowing your tooth to be mobile, your gums to be inflamed, you have dirt accumulated, and then eventually you have to lose the tooth. Or people that also have dental caries. Can you hear me, please? I think Dr. Taufik just wrote that he can't hear. Can anybody else hear me?
Yeah, I
Yes,
think
yes,
we can hear
we are
you.
hearing you.
Okay. So I
Yes,
think
we can hear you. Go ahead.
okay. So as I was saying, have to find a routine and a pattern, and the public has to know that. They have to know that there are these basic things we can do to prevent series of diseases, like the periodontitis I was saying that eventually leads to tooth loss. We can also have tooth loss from dental caries. So you have the decay is so bad that it's not restorable, and then you have to lose the tooth. So different things. Then another one we can mention is the oral cancer. One might think, oh, it's cancer. There's really nothing I could have done to prevent it. But from studies, we have that 70 to 80% of oral cancer could have been prevented by just avoiding tobacco, limiting alcohol consumption, and practicing good oral hygiene. Overall, it's estimated that 90% of dental diseases could be prevented with good oral hygiene, healthy diet. I'm saying healthy diet and regular dental care. Thank you. You
So
told me to
thank you very
summarize.
much,
I
Doctor.
hope that summarizes it. Uh,
Yeah, I think because this is a series, on another episode, I think we can start to elaborate more on the topics we'll be discussing about. But thank you for your insight and good statistics also. So the audience is, I didn't forget about you, but I had prepared some question I want to ask the guest speakers. So the remaining two questions. After that, there will be a time for the audiences to also to ask the questions. So the next questions I have is for the future we are planning. The Dental Medicine Chronicles in collaboration with All Africa Filat. So my question, Dr. Ligali or Dr. Miriam can answer that. So I was asking myself, how do you believe community-based platforms like this, Dental Medical Chronicles, which leverage in narratives and storytelling, can most effectively dismantle community stereotypes and elevate policymakers' awareness regarding the strategic importance of oral hygiene? So, can you hear the question?
okay. Thank you very much. Will Dr. Ligali want to go at it, or should I do that?
I th- I think you can go for it.
Okay, so summarily, this dental medicine chronicles that we are launching and we're about to start is a great step, because as Africans generally, we are born and bred with storytelling. We've been incorporated into it right from birth. As children, I mean, not this generation, the digital world where we are going to, but as children, you have people sitting around tables and then listening to stories from their parents, from their grandparents, and their aunties and whatever. So storytelling for us is a strong way to communicate to the public, and is an avenue for the public to listen to us, because that is our nature, is in our DNA. Storytelling, humanizing oral health, sharing personal stories and experiences can help put a face to oral health issues, making them more relatable and tangible for the audience. So when you give life experiences, you're not just reading from the book to them. You have several experiences, and then you tell them, so person, in as much as there's patient doctor confidentiality, you have rights to discuss about a case without mentioning the patient's name, and tell stories about it to the public. Let them learn from it. So that is one strong point we can book on and hope that the public will benefit from. We have breaking stigmas. The by the time we tell stories and people realize that, oh, I'm not the first person it's happening to in the world. I mean, it has happened to so person before. You break the stigma associated with that condition. I mean, dental caries can give you dental alveolar abscesses. That's a big swelling of the jaw. It can even give you Ludwig's angina. That's like a really massive swelling that occludes breathing, that prevents the patient from breathing. Most times, oh, don't let me use the word most. It depends on the facility they present and they're able to manage it. But when the patients know that, oh, I'm not the first person it's happening to, and you've told it true stories before they've heard about it, they will know that, okay, there's a solution to it. It's not just an automatic death sentence. So this will also strengthen the method that we want to use to propagate the dental health. Then it raises awareness. I mean, people are bored, people are tired. There are so many socioeconomic factors affecting how people view life, and then you're just telling a story to them. They might not be paying 100% attention to you, but they subconsciously they want to listen to a story. And coincidentally, your story is educative, so you are giving them what they need, both for their health and for their psychological, both for their oral health and their psychological status and their psychological health. So the next one is, as a community, how will it help? So if you have community-based outreaches, you are going to build trust. And that's going to involve their community leaders and their religious leaders. We're not going to rule out the religious affiliations we Africans have. And then we're going to bank on that. We're going to talk to their community leaders. When you can penetrate when you can penetrate the community through their leaders, because they are definitely going to listen to their leaders and whatever their religious, their community leaders and their religious leaders, whatever they are preaching to them, they're going to listen to them. So if you can penetrate them and educate those leaders, they are going to give you avenues to talk to them. And through that way, there is no bias. They have the trust in you because they trust their leader and they are going to trust you. They're going to listen to whatever you have to say. Then you are empowering them. Because eventually, after educating them and you realize that there are no dental professionals in that region, the little ones that are educated, or if you are lucky to be in a community where a lot of people are educated, you see people coming out to say they want to become dentists, they want to become dental surgeon assistants, dental nurses, and whatever. So you are empowering the community. They have more job opportunities to look into, and that is not as competitive, which is also as necessary as the other field. So I hope that helps a bit.
Thank you very much, Doctor. For also, I think the point about the religions involving religion was a good one. So, as we conclude with the interview questions and we go with the audience questions, I wanted to ask Dr. Ligali. Dr. Ligali, are you still there? Dr. Ligari, are you listening to her? So I don't know about his sound, but let me ask. So let me ask Dr. Milliam for the last questions. This is the last one. So I wanted to ask about the urgent message and call for action about what we are doing. So as we conclude, what is the most urgent and actionable message that this project must deliver right now to African policymakers and the general public? And what final word of encouragement would you share with the next generation of African dental professions? So, Dr. Milliam, can you hear me?
Thank you. Yes, I can hear you. Can you hear me?
Yes, I can hear.
So, to the public, to the policymakers, to everybody out there, this is an avenue for us to increase access to care. We might not be we those of us on these platforms might not be the direct policymakers, but we are a link between the public and the policymakers. It is our job to make sure that there's this increase to healthcare, increase access to healthcare, increase access to oral healthcare. there are different sections because people try to prioritize other sections above the oral health section, and which is also as important, if not sometimes more important than other sections. So it's our job to do that. One sentence I want to do is we are all here. It's a teamwork, it's a family work. We are here to push it forward, to push it to the next level. We are starting, and we hope that it doesn't just stop with us, it doesn't just end with us. We have younger generations that are also proficient in this new technology, artificial intelligence coming up. You don't really have to write a script to even tell a story. AI can just do that for you. So we need them with the skills that they are gathering. I mean, they should not just use the skills to totally divert into technology. They should use technology to enhance dentistry so that at the end of the day, we are enhancing the oral health of the entire public and the entire generations. If we increase access to healthcare, we promote oral health education amongst people. And this by doing public awareness campaigns, incorporating it into the school curriculums. So we have to incorporate, okay, this is time for dental hygiene education, this is time for oral health education. We have to put it into our school curriculums. So if we start from something as basic as the primary school, the basic 1 to 5, where they learn about these oral hygiene practices, is easier to move on from there, even when they turn to the secondary school and then they become undergraduates. Then we have to support research and innovations. And then we have to be ready to learn, unlearn and relearn whatever we've learned in the past, because I must tell you, there are new things coming up, there are new developments coming up in the field of dentistry and in the field of community dentistry. So the section of dentistry that really relates with the community is the community dentist. And then there are new developments coming up. So there is no one-way traffic about engaging the public. You cannot say, oh, storytelling might not work and all. And conclusively, when we integrate oral health into the overall healthcare, that's what I was saying about patients that already have morbidities, comorbidities, and then you make sure that the oral healthcare is part of their normal scheduled health, their normal scheduled medical health checkups. It makes it easier and it makes it affordable. If, for example, we um patients that are infected with the HIV virus, we have oral presentations and all. And at least in the institutions I've worked in, I know that it's part of their routine checkup to send them for dental checkups. And which is very nice because we know that we have oral presentations, oral manifestations of HIV and different conditions and diseases. So it's a teamwork. We all have to do it together, and we hope that eventually where we get it to, the younger generation will move it further from that. Thank you.
Thank you so much, Doctor, for your insight about what the policymakers, what their message should be like now about oral health. So I think I'm going in the comment section about the other questions people have asked. I see there is a question for Jimmy. He was asking about what policies are most needed to strengthen dental health care system and reduce inequality in oral health services across Africa. So I think it was what you were talking about, but the point here is about the inequality in oral health services across Africa. And the question goes to Dr. Rigali. Dr. Rigali, can you hear us? So, Dr. Miliam, I don't think Dr. Rigali is getting the question. So, can you help us? I don't think the sound is good to him. So I don't know what happened, but our speakers are not answering. But I wanted to thank everyone who was here today as we launched the Dental Medicine Chronicles. I know it was not easy in the first, it was not going well as we planned, but this is a series. The Dental Medicine Chronicles will be a series of more episodes, and so I see that Dr. Ligari shared the message in the group saying that I wish to quickly add that use of age-appropriate toothbrushes and age-appropriate toothpaste and recommended size of toothpaste should start from time of tooth eruption, usually 6 months of age. We should give such message to the mothers. So as future dental surgeons, dental professionals and healthcare providers, and also those who are listening to us, I can say that the message to share to our mothers and all the mothers we know is that the children need to use the toothpaste and toothbrushes which are appropriate to their ages.
Okay.
So as we conclude this first episode, I want to thank everyone who was here today. I know it didn't go as planned. The audience didn't get time to ask the questions, but I promise there will be another episode, another time. Not
Hello.
hello.
Hello. Can Sir, can you hear me now, please?
Yes, I can hear you.
Oh, I'm sorry. I was accidentally logged out from the entire meeting. I don't
Yeah, no
know.
problem.
Okay. You asked
So,
me a question before I got logged.
so someone from the audience, Jimmy, asked about what it was what we were talking about, but he added another point about the inequality in oral health services across Africa with other services. So, what the message to the policymakers?
Okay, so one thing we can give the policymakers in because we are rounding off maybe another section by God's grace is that they view it. The problem is not a deliberate thing. I don't think they do it deliberately, but subconsciously they view oral health care as aesthetics. They view it as, oh, it's just for fashion. They view it as, oh, it's a secondary thing. It's a secondary health matter. So they don't put their energy into it and until they have relatives or a neighbor or whatever associate that is with them that has a particular dental condition that they are seeking
Yes.
solution for. That is when they realize the importance of oral health care. So it's not their fault entirely. It's our job as dentists, as dental practitioners, as dental patients, previous dental patients, whoever has been a dental patient before, to connect to whoever they can connect to, talk to whoever they can talk to, educate whoever they can educate, their children will talk to their colleagues and whatever, and the news will keep spreading and will keep changing this inequality that we see in the oral health in the healthcare system that is affecting oral health. Thank you.
Thank you very much, Doctor. So, I think also another point I can add is that the people tend to come to seek attention from the dentist when they have toothache, when they start feeling the pain. And based on some conversation I have had with the dentist, and because also I'm a student, is that when the tooth has started, the pain has started to come. That when the tooth is having many problems. So I think also Dr. Rigali is back. So can you answer Dr. Rigali? Can you increase the volume so we can hear you? So I think Doctor is having some problems, but this was the first episode. We'll have many of more to come, and in this coming month also we'll have another session like this with another topic. So I wanted to thank everyone who joined us today. I wanted us to digest what we just discussed today, what they can do, and for the next episode, I want the audience to prepare their own questions so they have more time to ask the guest speakers. We have that time for some of the questions. So it was a privilege to be with blood-minded people like associate
Sorry,
professors.
before you go. Hello, hello. There is
Yes, I
a
can hear you. I
message
can
from
hear you.
Dr. Ligali. It seems he
Yes.
has internet issue. There is a message from Dr. Ligali on the screen. So I think you can
Yes.
read to the earnings of the participants. It seems he has some internet issue before we close finally.
So for Dr. Digali talked about the message says like this. I wish to quickly add that use of age-appropriate toothbrushes and age-appropriate toothpaste and recommended the size of toothpaste should start from the time of tooth eruption, usually 6 months of age. So we should give such messages to our mother. That is the message from Dr. Ligari. And also, I would like to thank Dr. Ligari, Dr. Miliam for their insights today, and promise them that what they teach us today and in other episode that we come, we are going to use it to transform our communities. So thank you very much, Doctor, for joining us. Have a great evening and have a good one. So thank you everyone for joining us today.
Thank you so much. Goodbye to you all. We thank our speakers. Thank you. Bye to you all.